My first answer that came to mind was just empathy. Like, is that person empathetic? Are they hearing you out? Are they not interrupting you? Are they listening to what you're actually telling them? Are they listening to your actual goals? Are they prying for more information? Because, you've seen the offices where it's like, yeah, so what insurance do you have? Okay, perfect. Aetna? All right, great. Get in the back. Here, it's completely different. It's like we're asking specific questions to help us, but also to show people that, like, we're not messing around. Like, we actually care about where you want to go. And, like, we care about you as an individual. So if somebody needs a full hour of manual therapy, we're going to do that. If someone needs a full hour of exercises, we're going to do that. If someone needs 35 minutes of manual therapy and 25 of exercise, we're going to do that. If someone needs a full hour of an assessment, we're going to do that. So we don't have any rules to play by in terms of billing and what we're going to get paid for. We're looking for an outcome. We're not billing session by session, and we're not having a third party dictate what we're going to get paid for. We're just providing you an outcome. You're paying us for whatever that goal may be. And so it's our job to get you there in that time frame that you're here with us.
I was excited when I heard you wanted to be on the show. I love your social media. I think, and I was really excited when you got your new clinic. It's weird because I watch your social media, and it's almost like when you watch someone's social media, like you see what's going on in their life every day,
right,
to a certain extent. But it's like we obviously don't hang out. But I noticed when you made that big shift. And for anyone who hasn't seen Jeremy's clinic, you got to get on his Instagram. I'll put the handles in the description. I don't think the way I describe it could do it justice. It's so cool. And I think if you once you see the pictures and you think like, oh wow, this is what a healthcare experience could be like. Mm-hmm. It would get me excited to go to the doctor for sure. So tell me about the clinic. How did that happen? You obviously designed it in a very specific way.
Definitely,
I'm curious and I'm jealous.
So I got to thank my mentor for telling me to stay in one spot for a very long time. Because, when you start your practice, I started from the corner of a gym, and which was great to get get the ball rolling. And we had all the equipment that we needed there. I could run my practice out of the corner, and it was great until a certain point. And then, when that time came and we were bursting at the seams, I had to start looking for, a space for ourselves. And when I ran into this space, not only was it in like a downtown area that I really, really liked, it was just like all open. And coming from my background, which is like football and strength and conditioning, and like, now more so in like the gym, I was like in heaven because I was like, look at all this gym space. So what we actually had to do was build out 2 treatment rooms and a small office, which I'm in now, so that we can have like the clinical side of it. The open space, all we had to do was kind of like level the floor and put a gym floor on top of it. But I was specifically looking for kind of like more so a gym with the room to be, to have treatment rooms, because I did do a poll, and interesting enough, most of my clients wanted closed rooms. So I thought about doing open bay, but most of my clients that we work with wanted that privacy. Mm-hmm. So we had to do a little bit of a build out. But again, I fell in love with the space, and I knew that the big windows right there with like the gym equipment would be really cool, and a good vibe for people. And they could see in and see like, wow, this is like, most people that walk in and stop by, they're like, hey, we were looking to sign up for a gym. That's just like a new gym in town, which always warms my heart a little bit. But I really wanted to make an emphasis and focus on the open gym space, the machinery, the equipment, just so that people knew that like we're not your traditional chiropractic office.
Yeah, I mean, you don't look like even like the traditional physical therapy office. I think it would be hard for people to maybe connect the dots to even know what you do. How did you end up where you are now?
That's a great question. I feel like most of it is stubbornness, like to not be so traditional. I thankfully worked for a place before even going to school that was motor vehicle accidents, straight chiro, 80 to 100 people a day. And I quit twice in the middle of my work shift at this office, just to give you an insight on how bad I didn't want to be there. And I kept coming back though because I knew that that was like the field I wanted to be in, but that was just not the way I wanted to help people. So I was stubborn in that sense of like I don't want to do just that, and I was also stubborn with like I was an athlete my whole life. I wanted to keep the exercise going in house and get people moving along to like that side of things. And so I kind of was just like, how can I blend everything I've learned in chiropractic school clinically with all of the strength and conditioning I've done since I was 13 years old, and blend that into a nice solid model. And we came up with this like kind of 3-step approach. Eliminate pain, the rebuild phase, which is like mobility stuff, and then the strength and conditioning performance phase, which allows me to do every single thing in each phase with each person. So when I found that out and I found out it was possible, I was like, this is exactly what I need to like focus on. And instead of going to the next machine or shockwave or this that, it was like, let's just get really really good at this process.
So you're able to walk someone through all the way through to get what they want. Because I think it's interesting. It sounds like traditional chiropractic or traditional PT, they got everyone gets phase one of what you just said. It's like,
Exactly.
let's get you more comfortable. But then to make those steps beyond that, because there's usually this huge gap, where someone comes in and they're like, I'm in pain or I've got some injury and it's preventing me from doing X, Y, and Z.
Mm-hmm.
And then when the treatment ends, there's still this huge gap between, okay, well, I'm here and I need to be here. And, that seems to be like your phase 2, phase 3. And
Exactly.
I think it's interesting because you prioritize the fitness space, and then you're like, oh, I got to add some rooms. Whereas usually the opposite, where someone's like, I'm going to open an office, I'm going to have these great rooms, I'm going to have all this stuff, and I got to squeeze in some dumbbells over there in the corner or something.
That's exact. So that was my whole mindset was that, like literally, let's focus on the bigger part, which is the gym and the long-term solutions, and we'll figure out how to do like the treatment room after. And honestly, that was the more annoying part. It was like building it out, making the architect draw out the rooms, like making sure we had enough treatment rooms, enough space still for the gym. We didn't want to like push the rooms out too far to then encroach on the gym space. Have a room like this where we could do phone calls and podcasts and stuff like that. That was like the harder part and more annoying part. The easy part was me just pressing, I want this rack, I want that rack, I want this barbell, that.
Yeah.
That for me was the fun part.
Well, I know for a fact, because we went to the same school, that this is not how we are taught to practice. Although, to give SCU, where we went, credit, I felt they were fairly agnostic. It was like, hey, learn the basics. This is what you're here to do. Practice how you want. I don't feel like they pushed anything on us. It was just a solid education. But even still, there was nothing that I recall from grad school that even closely resembles the way you practiced, other than probably like taking a history and then doing an orthopedic exam. You know what I mean?
Yeah.
But
I will say, you go.
No, yeah. So it's like you're practicing completely different from what we were taught. Not against what we were taught, just different. I'm just curious, how did you get so far away from, like, did you already know going into chiropractic school, I'm not doing any of this traditional stuff, I'm already going to, or were you thinking, or were you more of, well, I'm a little bit more of a hybrid, because I'm assuming you still do manual therapies and things like that, but it doesn't sound like that's a primary part of your practice.
So I think back to like the stubborn word, I knew, like you said, that traditional models were not going to be like the way I wanted to practice forever. So that being said, after we finished year one, which was part one boards, I started to go on a tear of like shadowing everybody that I could find that was like relevant. So chiros that were starting to do more exercises, PTs that were already doing exercise-based, like longer sessions, ATs, everybody, diplomate, teachers, all of it. And I just started to like pick and choose like the stuff that I liked. And a couple, I'd say there's probably like three main ones, three main people that I would consider OG mentors. Just showed me that it was possible that you can do 45-minute appointments, right? Eventually I made that an hour. You could do only exercise after your assessment. All of these like things that they don't teach you in school just kind of like opened up my vision, I guess, and like my ideas. And I remember being like, oh, well, I'm going back east. And I know for a fact, because I went job searching, none of the places where I'm going to be living are doing any of this. So why don't I just start my practice and start doing what I want to do straight out of the gate? And I'm so thankful for that decision, even though it was wild and crazy to most people. But it allowed me to eat shit for a while and like build the foundation now. Because like at everybody, you're not going to make it. Insurance, what are you doing? Like this is not typical. You know, a lot of people, even the closest people to me, were like, this is a bad idea. But I just, you know, kind of zeroed those noises out and continued to pave the way for what it is today. And it was a lot of trial and error. I tell people all the time, I don't practice anything like I used to practice when I first started. I've evolved as a clinician, as a business owner, and now it's a result of all the 7-8 years of, you know, that early stuff where no one was talking about this, and it was kind of like just me working underground and behind the scenes, part-time, you know, 3 days a week here, 3 days a week at the other job that I had to, you know, unfortunately be at because I had to pay my bills. But while I was doing that, this was slowly building and building and building. I would continue to learn, and then it evolved into what it is today.
I love that concept of the fact that you're different now than you were when you started, because I think it's an interesting thing because, you know, people are always comparing different options. You know, they're out there shopping for healthcare and, you know, they're looking at someone maybe who's been in practice for 20, 30 years. And then they think, well, they've been in practice longer, they must be better. And it's like, I don't know. I feel like the longer someone's in practice, there's a gap filling up or forming. So either
100%.
they're really good, like really good, which means they've adapted and they are practicing very different than they did before, or they're garbage. They've been doing the same thing that was, you know, that was out of date probably when they learned it 30 years ago. Because that's the sad part about it is there's just education, grad school it's a big ship to turn. You know, you learn out of date stuff. They can't change board exams quickly and things like that. So, you know, and I've worked for people and when I've asked them, you know, you've been practicing a long time, why do you do this? And it's like, well, this is what my mentor taught me when I got out of school, or this is what I've always done it. And it's like, oh my goodness.
Yeah.
Oh, really? That's the depth of the thought you've put into this. You haven't thought that maybe things have changed over the last few decades. And so there's some people out there like Craig Liebenson comes to mind. I never met him, but I've heard him say that, you know, he hates being known as like the father of corrective exercise. He doesn't recommend that you buy his original books because he's changed his mind on so many things and he's changed so much. And so I think that commitment and that level of humility from a healthcare provider in any profession, I think it's unique and
big time. I think like exactly how you said it. If you're not evolving, you're going to become one of the dinosaurs. And so I used to do a lot of McKenzie, a lot of DNS, and like I've kind of evolved from that to honestly more of like the strength training portions of all that. And PRI helped, you know, catapult some biomechanic education. But yeah, it's kind of like a mix of just everything that I've learned and used in my experience, and it's helped. I've gotten rid of the bad stuff, and I continue to do the stuff that I like and helps get people results.
And you get to be super flexible with that because you don't take insurance.
Very
So
flexible.
talk to me about that, because
Yeah.
I think that's a hard thing for you have people, a lot of people out there have insurance and they're like, well, why would I go to a healthcare provider who won't take my insurance? And I think there's pros and cons to it. One of the pros would be, well, that healthcare provider is not beholden to an insurance company. He or she can do whatever they want in your best interest. But I wonder, how do you address that for potential patients who are like, I don't know, I think I want to use my insurance, or why would I look at someone who's charging cash?
I think there's definitely a shift happening, and most people that we work with are like expecting at this point, like, oh, yep, this person must be like, a little bit better than the other places because they don't accept insurance. So just that like mindset shift in the past couple of years, I feel like I've noticed, and it's been a little bit helpful in the marketing and sales process. But yeah, that's why I'm so obsessed with social media and like spreading our message and showing people value for free on social media, because there's so much that we can offer compared to those in-network places. And we don't have, like you mentioned, anybody telling us what to do. So if somebody needs a full hour of manual therapy, we're going to do that. If someone needs a full hour of exercises, we're going to do that. If someone needs 35 minutes of manual therapy and 25 of exercise, we're going to do that. If someone needs a full hour of an assessment, we're going to do that. So we don't have any rules to play by in terms of billing and what we're going to get paid for. Like, that is our prices. We're looking for an outcome. We're not billing session by session, and we're not having a third party dictate what we're going to get paid for. We're just providing you an outcome. You're paying us for whatever that goal may be. And so it's our job to get you there in that time frame that you're here with us.
What kind of outcomes are people coming to you for?
Ooh, I love that. So it could wide variety. It could be picking up my grandkids. Could be running a marathon in April. Could be running 2 miles without pain. Could be improving my hip internal rotation from -10 to 35. It could be any sort of those things. Deadlifting, 450 without pain. Um, Things of that nature.
Okay.
Whatever it is that that person wants to do, we fit it into our 3-step process. Some people might spend a little more time in the maximize performance phase. Some people might spend the whole time in the rebuild phase. Other times, the eliminate pain phase, which is our first phase. That again could be 2, could be 10. We're not 100% sure, but we just make sure that we have that outcome as our guiding light.
So I'd imagine when you're having this conversation, people, a lot of them say, "Oh, so you just do physical therapy then?" How do you, how do you how do you navigate that?
You're like, well, no. um, so I immediately pull out like the title conversation, like, hey, I don't really care about the title. Again, we're just focused on getting you better and what your goal is. That's all that matters to me. I don't care if I'm a PT, I'm a chiro, I'm a trainer, whatever it is you want to perceive me to be. It's irrelevant. I'm going to do my best to get you out of pain and then get you to your goal.
Yeah, I think a lot of people don't realize that every state's a little bit different, but essentially, chiropractic license and a PT license are almost identical. There's some
It
subtle
should
difference.
be.
Yeah, there's some subtle differences, but like the meat and potatoes of it's the same thing. And
Yeah.
so I think that, like, if someone's like, oh, maybe you don't do as much chiropractic, and it's like, you mean I don't manipulate joints as much? You know what I mean? But PTs
Right.
can do that. We have a DO in town who does a lot of manipulation. So we don't, as a chiropractors, we don't own that. We're just kind of known for it. But
Right.
on the flip side, PTs don't own rehab and exercise. They tend to be pretty good at it for the most part, better. I mean, they get more training in it, I think, formally,
Mm-hmm.
but chiropractors, who seek that education and have that background in strength and
Right.
conditioning can do just as well, if not better in many cases, just depending on the way things are set up. For example, I was talking to someone the other day who was talking to me about their physical therapy experience. And they weren't super happy with it. And I was having to describe it, and I was like, yeah, it sounds like you're going to kind of a just a run of the like a PT mill, kind of like you're seeing it. You saw the physical therapist for 10 minutes one time, and then it's just been a PT assistant watching you go through stuff. And I
Hmm.
was like, have you ever considered going somewhere and paying cash? And he was like, oh, I am paying cash. They don't take my insurance. Oh my goodness.
Yeah.
You know, but that's an interesting thing. It's like if you go to, and this isn't just PT, this is chiropractic as well. If a clinic is, if they're set up for insurance patients, and you come in and you're like, I'll pay all cash, they can't change their system for you. You know that, like it just doesn't work that way. So
Hmm.
you're just gonna pay 100% for the care that that is set up for low insurance reimbursements.
Exactly.
And I think that, and when I explained that to him, his eyes got wide and he was like, so you're saying I'm just throwing money away? And I was like, I'm sure there's benefit, but I think you could probably use your money better. You know what I mean? Like, it's not even like necessarily working with me or someone, you know what I mean? Like, I would find somewhere that like is going to treat you different if you're paying more,
Hmm.
or at least has the flexibility to do it. And I think that's what you're describing is like your clinic seems like you thrive on the flexibility because
Yeah.
you can do anything with anyone, whatever they end up needing.
And that, to make it full circle, helps us speak with so much conviction in the sales process. Like, there is zero doubt in our minds that this is your best option. So when we're like talking to somebody and they're like, "Wow, that's a big investment," we're like, "Totally agree with you. It is."
Yeah.
However, this is 100% the place for you to be, especially with the goals that you have and your exercise background. Like, again, no offense to the other places, but like you just mentioned, like you're gonna get very low level cookie cutter treatment, which may or may not help.
Yeah, I think that's the frustrating part for people. I when they go that route and then they don't get what they want,
Hmm.
and then it's yeah, they saved a little bit of money, I guess, but they didn't get what they want. So did you really save money? You
Right.
wasted a bunch of time, and I think a lot of my patients' time is really valuable. You know what I mean?
Yeah.
So if they can understand, you know, the investment, I guess, in a way. So it's
Right.
you might
And the
pay,
time is.
yeah, you might pay more money up front at a cash clinic, but ultimately, if you get what you want at the end of it in the time frame that you wanted it, is there any buyer's remorse with that? And if you've
Mm,
learned something along the way and you know how to handle this issue in the future and you don't feel like it's going to be as much of an issue, well, do you save money in the long run? Do you save time in the long run? Do you save frustration in the long run? But I think that's hard to communicate with people sometimes until they've gone down that path. And I think
hmm.
that's a frustrating thing when someone's like, well, I'm going to go try this. And it's like, okay, you know what I mean? You got
Yep.
to live your life, but you know, it's like, it's going to be, I'll see you in a year, I guess, when
Yeah.
you're really, really frustrated about this. And it's
But
not always
even.
like that. Sometimes people get what, if you can go get what you need at Walmart, you should do that. I
Yeah.
do that. You know what I mean? Like sometimes that's just what you need. And that's, why would you spend more? You know what I mean? And
Hmm.
I totally get that, but sometimes you can't. And sometimes
Right.
shopping for healthcare, it's not always best to like shop for the most immediate bargain.
Exactly. I have two thoughts on that. One, when it comes to health, I'm not going to be the Walmart guy, and that's why again why I'm passionate about like what we do. And then number two, to further play on the story about you go to this place, it's affordable, but like they're giving you the same stuff. Now it's not working. Now they're like, well, we need to go get a surgical consult. And then you get the injections. Those don't work because those are just band-aids. And then you go to the surgeon and they're like, they just see one specific route for you, right? And now they're recommending surgery, and now it's like a spiral. And so that's in our free discovery visit. if someone needs me to play out that whole scenario, I will. But I'm like, this is where I don't want you to go down this route. And I have seen it time and time again. People that that leave here and don't come back, we try to refer them to a helpful place. But if they don't sign up with us, like this is typically the story that I see. So of course, it's a big investment. We totally understand that. However, like we just want to be clear on what we're providing and like how we can avoid that situation, because that's the toughest part about this job is like someone saying no and then they dwindle off and then eventually they got a hip replacement or knee replacement or back surgery, right? Like that's worst case scenario in my book.
Yeah. Yeah, it's one of those things like I hate even the concept of fear mongering, but sometimes it's like I've seen it so many times. You know what I mean? There's a very clear pattern here,
Yes.
and so I'd almost feel bad not playing this scenario out just because, like, I want you to understand, where you could end up with this.
Yeah.
And
I used to be also on the same page as fear mongering. Like that sounds like a little bit of fear mongering, but actually now that I'm like 7, 8 years deep, I'm just telling you how it is.
Yeah, I think a really basic example is there's a guy who's been kind of almost 2 years now, been deciding to go do care or not do care. He's low back pain. And recently, I just keep in touch with him. I DM'd him, and he was like, "Yeah, finally got some answers. I got a disc problem." I was like, "Okay," you know what I mean? And we laugh about it because it's like that's not like it's so common.
Yeah.
And if that's it, I'm so happy.
Right.
That's so
Exactly.
simple. It's going to be uncomfortable to deal with, but you've missed out on 18 months. Like we could have, if that was it, man, that could have been done we could have taken care of that a long time ago. So I think sometimes people, they want concrete answers before they want to take action.
Yeah, that too. Do you get this question a lot? Like, should I get an MRI first? I'm like, no.
Yeah.
Please no.
Well, yeah, and it's one of those things where I'm like, okay, here's what I would suspect is going to be on it.
Exactly.
But I would also suspect that if we took 1,000 people who don't have anything you're feeling and we MRI'd the same joint, there's a certain percentage we're going to find the same thing. It's just not causing them any pain. So even if we see it, we don't know that that's what's causing the pain. It's one of those things like, yeah, you're like, there's nothing, because I think that's another thing too that kind of frustrates me about the chiropractic profession is that we don't use imaging appropriately, at least for x-rays. I mean, right. That's maybe too broad of a statement. I think there's a lot of traditional chiropractic care that just x-rays everybody. And if people are listening and you're like, what's wrong with that? And it's like, there's a lot wrong with it. I probably should just do a whole episode with a radiologist on it. But just looking like this whole concept that structure equals function, if you got gnarly scoliosis and you're like hunched over and you're a surgical candidate, then yeah, structure is going to affect your function quite a lot. But if it's not an extreme case, I don't know. You're just looking for a scapegoat.
Yes.
And a lot of times you're seeing stuff that you can't change anyway.
Right.
There is no way to change that, or it will change over time. It'll heal or it won't heal. It just is what it is. It's a finding. And it's like, well, you can't do anything about it anyway. It's just something like, I just always feel so bad for my new patients who come in and they have their x-rays on their cell phone from a previous chiropractor. Oh my goodness. You know what I mean? Like I've just
straight neck.
Yeah. I've just never, it's like someone put a heavy backpack on them one day and they've just been carrying that around,
Yeah.
Because they got this x-ray and this is the cause of anytime they feel something, they look at their they got this x-ray and it's like, and I had to tell someone recently because he had been to that type of chiropractic, and he wanted me to continue care to correct those things. Specifically, he knew like the term for chiropractic subluxations, and I was like, "Look, I can work with you, but I can't tell you that I'm doing that."
Right.
Like, you know what I mean? Like, and I try not to have that conversation. Sometimes I'm just, if I can get around it, I'm just like, "Yeah, okay, cool. That's not what I see.
Yeah.
If you want to work here, these are your options, or this is how we're going to put some emphasis on your problem." But sometimes people actually, they think a certain way because they've seen images. They went to imaging too early,
Mm-hmm.
or that was the first thing they did. And then, going back to fear mongering, it's like, well, I can see that bone spur, or I can see the bone on bone. And it's like, oh man, you're going to make healthcare decisions based on that. I
Right.
understand it. I understand from the patient perspective why it would freak them out.
I think a big part of our practice and why we're successful with a lot of people is we're not just physical. Like, there's a whole mental component to that. Obviously, I'm sure you know that. So, certain behaviors and language, we just don't even like allow. Like, if people are talking in a certain way, like, we'll make it a joke, but like, oh, no, that's not what we say here. Like, my bad side, or, no clinician is ever allowed to say, like, that's my shoulder patient. Things like that. It's just like a culture. And there's no way that we're allowing that because those little things feed into what you just said and then negatively impact the outcome of a patient's plan of care.
Yeah.
So we make sure that within a plan of care, someone's here, everything's positive, kind of like Craig Levinson, right? A positive experience with movement. That is like a definite focus because they're getting so much negativity from the X-ray person or the MRI person or whoever it is, telling them like, this is how broken you are, this is how messed up this is. We give the full opposite experience on purpose.
Yeah, so that's an interesting thing about like the placebo effect is that you can just put it on whatever you want as a clinician.
Mm-hmm.
I think historically chiropractic has relied on the placebo effect pretty heavily for joint manipulation. Not that there's not other benefits to it, but clearly there's a strong placebo effect to hearing a joint crack and then putting a narrative behind that. But I think what you're talking about is like, okay, well, let's take all these negative words out. Let's not make you feel like you're broken or something that needs to be fixed. And then let's put this placebo effect on like the agency we can give someone. Like, let's just get in there and start. Like, you've got back pain with picking things up. Let's deadlift something. You know what I mean?
Yeah.
And then they start to have like, instead of these negative experiences that are associated with bending over and picking something up, for example, they start to have positive experiences with it. And then you just keep stacking positive experiences. And then that becomes clinical care, which is kind of cool.
Yeah.
You know what I mean? It's like, instead of just doing stuff to people, it's like, no, you're just making positive experiences, moving in a general direction towards what they want until they get what they want, which I think is really powerful. And I think to go back to the not taking insurance, you have the ability and the freedom to do that. You know what I mean? And people have the ability to pay for it.
Yep.
Where, like I said before, sometimes you'll go into a clinic and you'll pay cash, but they can't break their model.
Right.
You're just going to get the same 5-pound dumbbell and stretchy band thing that everybody else gets because you are a low back pain patient. You've been labeled. Or you are a rotator cuff.
Right.
You know what I mean? And it's just going to be the same set of exercises or same set of manual therapy things that probably statistically get the best results.
Hmm.
So, do you
No, we're
guys,
not.
for you and your clinicians, because I'm sure you have some type of clinical structure, but then there's got to be like a lot of freedom within that. So, because I would imagine that you're not all treating completely different. So how do you set that up with, like, if someone's going to come work with you and it's like, well, I want to stick with my regular, but if he's sick or if she's sick or something's going on, I would like to be able to continue my care for that week with
Yep.
somebody else. How do you guys, what unifies you guys as clinicians? And then
That was
how do you get to like use your own skill, to shine as an individual clinician?
That's a great point. So when I hired for the first time, the goal was to share as much that was in here, right, and pass it on. Um, Now that I've had my second associate be onboarded, the three-step process is a little bit more specific in terms of like what exercise prescription we're going to be doing. But like you said, there's like foundational principles, and then there's the freedom to do whatever you want to do with that person that you feel is best and necessary, and especially like tailored to their goal. So in the first phase, we follow like pretty much like I don't know if you know Bill Hartman.
Mm-hmm.
So we follow like a similar assessment process to what he teaches. And so in the beginning, most of the exercises are designed to create space. And so like you go over all of those, you train through those. This is this scenario, this is this scenario, this is this scenario. There's a bunch of foundational principles. There's a bunch of ways to also do variations of those. That's like typically phase one. And then phase two is like a bunch of, does this person need internal rotation, external rotation, hip flexion, like whatever it is. There's like that classification of exercises. There's a million ways to do it, but like that's like the baseline principle. And then the strength and performance phase is pretty much your strength and conditioning brain being, creative. So in the first couple phases, it's like, this is kind of like our process. And then in the third phase, it's like, let's have a little bit of fun and push it and see where we can get.
How long is a typical treatment plan for you guys?
I would say 16 weeks.
Okay.
That's like our middle package. The most common one, 12, 16, and 20. People do continue on and do more than that. It's, they feel like they like it here, they want to get more results, they want to keep pushing it. But for the most part, it's typically 16.
Okay. I'm curious then, if we rewind back a long time ago, why'd you even want to become a chiropractor? Because it doesn't sound like you had this plan when you made the decision. So
No.
why did you want to, and where did you see yourself going with the profession when you made the choice?
Wow, that's deep. So I worked at a chiro office after I played football at Monmouth University. So after football, obviously didn't go pro. I worked at a chiropractic office who was my neighbor. And he saw me one day, actually before my season even ended, coming home in a neck brace. I had a sideline accident, stinger, concussion, all the above. So he saw me in a neck brace, and that's how I kind of got introduced to chiropractic, was through him, and he invited me to his practice. And I was like, oh, wow, this is actually pretty sweet. So I ended up working for him after I graduated, and I really liked the idea of obviously helping people and communicating with people and showing them like to get out of pain. Even as an assistant, I like got that feeling sometimes of like, oh, I played a role in like this person feeling a little better. And after being there for like 2 years, the chiro himself was like, I think you'd be really good at this. Like, you should go to school. And it was always like, I don't know, like, maybe PT, maybe I'll be a trainer. I didn't know like which direction I was going to take it in. And at that point in time in New Jersey, PTs had to have a script from an MD to be able to like treat, right? So I was like, all right, that one's definitely out. Chiropractic, you can like start your own practice, you can do your own thing like right away. So I eventually, to make a long story short, made the leap, having no idea what I was going to do. But I knew that I wanted to help people, and I kind of liked the profession, you know. So then backtrack to where I was saying, like after year one of chiropractic school was just like a freaking just shitstorm, to put it lightly. Like my best friend was in California at the time, and I saw him like 3 times in a semester. That's how crazy it was. Just stuck in the library all day long, sciences, and just hitting the books, hitting the library every day. After that phase was finally over, I started to see like, okay, I definitely don't want to do what we'll call him Dr. X was doing here. I don't want to do any of the car accident stuff, lawyers, orthos. I didn't like that. How is there a way where we can do what we like, help people in our version of helping people, which was like the student athlete. So that student athlete brain that I had, I've been lifting weights since 13, high school, college. Like I didn't want to stop that, and I had too much experience in there to just like give that up. So I was like, how can I just blend that world with the new world that I have of like the clinical part of it, and mix and mash and have like this awesome product where people come in pain and they leave doing the fun stuff that I like to do too. So after shadowing from pretty much term 5 on, and then doing my internship first with Dr. Murray in Santa Monica, who is a huge sports medicine diplomat guy. Huge shout out to him. He helped me a lot. He just even showed me that like exercises were possible in a treatment with a chiro. And then I met Dr. Gonzalez, who was doing the 45-minute appointments. Sometimes he didn't even touch a patient, and I was like, whoa, this is starting to make sense. And then I came back to Jersey for my last semester, and I shadowed Dr. Justin Rabinowitz, who's currently my like business mentor. And he was doing like exercise-based DNS, McKenzie. And so all of those like experiences kind of like led me to like, all right, there's not really any like rules here. Like this is my practice. I'm going to do this stuff, and I'm going to do it my way. And I'm also going to use my clinical background to do like the soft tissue work, the assessment stuff. So I'm passionate about that part, but I was also not going to let up the passionate part about getting people to exercise again. So all of that to say, pretty much was like, all right, I'm not doing half hour. That's too short. Hour seems about right, because I was running out of time with people with the 45-minute appointments. Hour session, you get to know the person, you develop a very good relationship, understand their body, understand their goals, and then over time that develop into a plan of care, which is a package. And that way there's specific like progressions and phases. And so all of that like kind of, I slowly, after like years and years and years, like that slowly came about. So it definitely wasn't like, oh, this is what I'm doing, like starting like term 5. That's the one. It was like literally an amalgamation of thoughts and experiences and all that. And like, all right, this fits more of who I am. Not like, I'm not going to fit the profession. I'm going to make the profession fit me.
Interesting. So what you love about chiropractic then seems to be the flexibility it gives you to help people how you want to help them without having to fit a specific narrative.
Yeah, I would say the root cause is the root cause of me getting into this was the moment of when someone smiles and says thank you, like you changed my life. And that I got a small taste of that as an assistant. Not even doing the treatments, I would just do everything else. But just being a part of that when I worked as an assistant, I was like, that would be awesome to be the guy that actually like got them there. And like at the end, shake hands, like because of you, I'm a better person and I'm not in pain and I like can continue on to do like awesome stuff like hiking with my kids, jumping off a bridge with my family. Um, like that was a really cool one. A lady who had been diagnosed with Ehlers-Danlos syndrome. Actually, sorry, misdiagnosed. No one ever gave her a diagnosis. They just said, "You're screwed. This is life for the rest of your being. Like deal with the pain, injections, ablations, all that stuff. Nothing ever worked." She gave me a shot, and that was like her story. Like they went to like Nevada. They had this like family trip. She didn't have to use a motorized scooter. She didn't have to wear an SI belt. And she was like diving. They were like cliff jumping and stuff off of like this crazy bridge. And she was like, that would have never happened, like ever. So like those moments, it was like I was like, this is exactly what I wanted.
I'd love to hear your opinion on this next one. A number of years ago, I think I was at a dinner party at my friend's house, and he was asking me about chiropractic care, and I know him pretty well, and it was kind of off the record, so I kind of opened up about some of my frustrations, and he was like, well, how would I know then that I'm picking a good one? And I
Ooh.
was like, that's interesting. And he was like, and he just kept going. He's like, he's like, how would I know if I'm picking a good medical doctor? How would I go if I'm picking a good dentist?
Mm-hmm.
And I was like, no one's ever asked me that before. I honestly, I've never put any critical thought into it, but it's something over the past couple of years I've thought a lot about, and my answer changes and evolves so much. And I like to pick other people's brain on this question, because I had read something, it actually came out of SCU. I think they called it the supermarket effect. So it's like, you go to the supermarket, you go to the chip aisle. How do you pick what chips you're going to get? You essentially have unlimited options. Even if you understand what meal you're having, like say you're having Mexican food. So, okay, I'm getting tortilla chips. That doesn't really narrow it down a ton.
No.
Now, the things that are at eye level are put there specifically, right? That's what they want to sell.
Yep.
You know what I mean? So now you're looking at marketing. You're looking at bag size. You're looking at all the labels. Are they true? Like, does it
Placement.
matter if it's gluten-free, or like, do you really care about that? It's a
Yeah.
big label. How are you going to make that decision? Are you going to make that decision based off what's cheapest?
Mm-hmm.
Are you going to make a decision based off what someone recommended? The main point of it is it's up to you. You've got to make the decision, and you've got to live with it. And if you're picking chips, who cares? It's not that big of a deal. But if you're picking healthcare providers, that decision it'll set something in motion. And in 2 years, it could have a huge effect. Either you got what you want or you didn't, or something got worse, or something got exponentially, like your health got worse. Because like I think a lot of times people go to a healthcare provider and they'll be like, we should rest. And it's like, okay, great. They had knee pain, and you just increased their risk for Alzheimer's and dementia. Nice. You know what I mean? Like,
Yeah.
you increase the risk for heart disease, because they got tennis elbow. Brilliant. It's just like, it
Right.
doesn't make sense. So people, they go into this scenario, and it's like, it's up to you as the individual to pick the healthcare profession, to pick the specialty within that profession, and then to pick the provider if you have all of those options. And then depending on your choice, it's going to dictate your outcome. And you have as a person who's not a healthcare provider, you're also given nothing. You have you know what I mean? Only what you see on social media,
Yeah.
or what a website looks like, or what someone randomly said. So how does someone, we can make it, I guess, more specific to, like, let's say pain, like musculoskeletal problems. So chiropractic, PT, somewhere in that realm. How does someone know if they're selecting the right healthcare provider?
Wow. Now that you put it that way, my first answer that came to mind was just empathy. Like, is that person empathetic? Are they hearing you out? Are they not interrupting you? Are they listening to what you're actually telling them? Are they listening to your actual goals? Are they prying for more information? Because, you've seen the offices where it's like, oh, yeah, so what insurance do you have? Oh, okay, perfect. Aetna? All right, great, get in the back. Here it's completely different. It's like we're asking specific questions to help us, but also to show people that, like, we're not messing around. Like, we actually care about where you want to go. And, like, we care about you as an individual. I just said this in a post yesterday. Like, I care about the results the same, if not more, than most of my clients. Like, I want it so bad for them that it keeps me up at night when, like, something's not going right. So that, I don't know how you see that from afar. That's why I'm so gung-ho on social media and about spreading who I am as a person, who we are as a brand, like how we're different. That is so important to me because we're not the same. We're not even on the same wavelength as the guy down the street. Like, it's not even close. For those reasons, we're empathetic, we care, we have a very, very extensive background in strength and conditioning, so it's not just chiropractic care. And so we're blending two very important worlds, where you're at right now with the injury and where you want to go in terms of performance. Like, there's no better option. So in terms of finding a provider, I think that A, they better have empathy. B, they better have a background in not just chiropractic care. Better be like exercise science, kinesiology, strength and conditioning, whatever it is, not just chiropractic. So there's got to be a blend. And then there's got to be, like you said, like not just like a pink band in the back with a pink dumbbell. Like, if there's space for you to move, doesn't have to be the craziest equipment like we have. Doesn't have to be two prime fitness racks. But if it's a space for you to exercise and a space for you to move and a space for you to get customized one-on-one quality care, that to me is like a green flag. I've made this post too, red flags for a chiro. They image you right away. They are selling you on just treatment plans that are just including manipulations. There's no, exercise portion to it. There's no communication. There's no videoing. There's no analysis. There's no assessment even. I mean, imagine that. Like, imagine just like no assessment. You're just like, yeah, you know what? Let's just track it, see how it goes. That's a huge red flag. Like, what information are you using to enforce your treatment plan if you're not doing an assessment? That might be my number one. Now that I talk it out.
I don't have to imagine it. I worked in one of those places. So.
Yeah, it's very common. And that's why, most people, when they come to us, they're at their last leg. They're like, I've tried everything. And I'm like, have you though? You haven't tried us. But they've been through those bad experiences of like the cookie cutter, high volume, just like you're another number.
Yeah. I think something that's important is that people change their minds and they grow.
Mm-hmm.
There's a quote, it's accredited to Elon Musk. I don't know if he actually said it, but I think it's brilliant. Whoever said it is that it's just always assume that you're wrong and just aspire to be less wrong.
Yeah. It's really.
And so I feel like a good clinician, a good doctor is someone who has changed their mind. And they'll do it unapologetically because it's the right thing to do. Because there's new stuff. You learn new things. You change. So I'm curious, since you've been in practice, what's something you've done a complete 180 on? Or is there anything?
Ooh, that's a good one. No, definitely. I mean, not to get too specific, but like, there's specific exercises that I purposely have not done in 5-6 years, just because of the cookie cutter places that do them, like Mackenzie press ups. I just refuse. I refuse to do a clamshell. I refuse to stretch a hamstring. Like, I refuse to do those things that most offices do, because not just from a pride aspect, but also like to show people that, like, yeah, that might work for like 60% of people, right? Maybe. or maybe it's just time. Who knows? But that's another conversation. Um, at least you're going to get very specific and different exercises here. And even if I thought that those were the best option, which I don't, I still wouldn't use them because I've evolved as a clinician, and I feel like there's so many bigger rocks to hit and so much more bang for your buck in other things that like that's just like almost like a distraction. And it's like, oh yeah, like we're doctors, this is what you do. To me, it's a distraction, and I now am hyper focused on that, and I don't let it distract me.
Clamshells are funny. I can't remember there was a PT I heard on a podcast once. I wish I could credit him with this. I can't remember his name. He was saying that he's got like certain criteria for exercise selection, and it was like three things or something. Is it appropriate for them at this time? Is it going to move them closer to the goal? And then how ridiculous are they going to look if I make them do this in public? And so,
that is a good one.
It's like things like clamshells are out. We're just not. I'm not going to ask someone to go to a public gym and sit there and do a clamshell.
No shot, especially the people that we work with. It's just not happening.
Yeah, it's more like a punishment than it is. I mean,
yeah.
Not that it's a bad exercise. It's just it looks ridiculous, and there are other ways you can hit those. You could do. You can. It's not the only thing out there. It's just
exactly. And I feel like when people are not doing them, they're like, "Wow, thank you." Like we're not doing like the same shit we did at the other 4 offices we went to.
Well, yeah, that would be frustrating if you're like, this is the same as going to like an insurance-based clinic. You've got to be able to level up,
right?
And provide. I think it's interesting because when you're a cash-based provider, it's 100% results-based.
Yeah.
You know what I mean? And I think that's
you better be getting that.
And I don't think that patients can really understand that. And it's hard to say because it's like when I've worked in insurance-based clinics, I'm time-based.
Yeah.
I got to get in and out in a certain amount of time. I have to bill a certain number of things. Like that's what my boss said. You know what I mean? Like they watch all that stuff. I'm not assessed on outcomes. I'm assessed on like billable codes, and there's a million people with your insurance. It's gonna work itself out. It's fine. But when you go to a cash-based provider and you pay them thousands of dollars, they can't just punt that into the stands. You know what I mean? That's their reputation. It's like we almost become like a high-priced defense attorney.
Yeah.
Like that, because I've had patients where I'm like, I'm not 100% sure I can get you what you want.
Oh yeah.
I'm willing to work with you, but I got to be up front. You know what I mean? Like, it might not work out the way you want it to, and I don't want to mislead you to think that there's going to be some amazing outcome here. But all I can promise you is I'll bring 100%. And I'll do the best I can.
Right.
But I think from that perspective, sometimes people go with it, and sometimes people go, okay, well, I don't want to spend the money if you don't feel confident. And it's like, okay, well, just being able to be upfront with people about it, because I don't want losses on, you know what I mean? Like, my business depends on me stacking wins.
Exactly.
So
we do an extensive
so you got
sales process to find that out.
Yeah, so you gotta bring it. You know what I mean? And to your point, keeping you up at night, if stuff's not working, I can guarantee the listeners out there, if you're paying a cash-based provider thousands of dollars and you're not getting what you want, it's bothering them. They're thinking about you. 100%. They're opening up books. They're getting on Instagram and DMing friends and like trying to figure out like, what am I missing? What could we do?
Yeah.
You know what I mean? Like you're paying for someone to work on your behalf, because we are nothing without the results. That's all we have. So I think it's an interesting thing for people who are like, well, why would I pay cash? And it's like,
go try the other option.
Because you're going to get someone who really cares.
Yeah. Well, that's the thing too. I always say is if you're gonna do this model, you better be freaking good. Like, don't even don't bring the other side over here. Don't try to bleed into our world because it's not gonna work, and people can sniff it out right away.
Yeah. And I think it's one of those things too. It's like you can grow into it because I think people like the honesty. You know, sometimes I'll get cases where it's like, I don't know, I've actually never dealt with this, but I can figure it out.
Right.
You know what I mean? Like sometimes I don't, if I don't have a lot of confidence in it necessarily. I had a young woman, very young, who had a joint replacement because of a tumor.
Wow.
I've dealt with elderly people with joint replacements, but they have different goals.
Right.
Her goal is to run again. She lost a knee. You know what I mean? And she wants to,
Yeah.
but she's really young and she wants to go out and run half marathons and things like that. And it's like, I've just never had a joint replacement patient come in and want to do that.
Right.
But I was like, wow, we'll figure it out together. There's not a textbook for this.
No.
For what you're talking about. So I think sometimes people, they like to hear, I don't know.
Yeah.
They like that level
definitely.
of honesty, which again, you can't have if you're not having conversations.
Yeah.
And you can't have conversations if you're not getting reimbursed for it.
Exactly.
You know what I mean? So I think that's one
It's
of
very
the...
transactional. That's the word.
Yes, that's a good word for it.
Extremely transactional, which again, most of my clients become friends here. So
Yeah.
it is not transactional. They're giving up a lot to be here. Time, the investment, what's required of them, what's expected of them, because we check every session. I know if someone's done the exercises or not. I will always check the work.
What's the accountability piece? I think that's what people fall off treatment plans so easily when they're not held accountable.
Yeah.
The standard has to be high. It has to be set pretty high.
And that's
because a lot of their goals, it's like, okay, you can get there, but I'm not going to sugarcoat it. This is going to take a lot. This is going to take a lot of work. It's not going to
be like this magic wand to get you there.
Yeah. Yeah. So what do you
100%.
think? What do you think? What role should chiropractic play in our healthcare system? Because what you're describing right now is almost like a different profession from what most people would think of when they think of chiropractic. Is this something that we should change the chiropractic profession, or is this something we should keep this kind of variability? Like, how do we even fit into this system?
I think it's moving towards a hybrid, and like just this clinician that has the extensive background in science and the human body, and then the exercise and strength and conditioning principles. Again, not to toot my own horn, but something similar to like that background. We have a huge opportunity for people that are, 40s, 50s, 60s, trying to get the last couple of years out of that, active lifestyle and push it and prolong it as long as possible. Longevity is a big buzzword in today's healthcare. And you don't need all the fancy equipment like what we do without an oxygen tank and without the lasers. Like what we do is very, very helpful for those people specifically. And that's exactly who I've tailored my marketing towards, is like people that want to keep it going. They care about their health. They want to push it. They want to stay accountable. They want to stay mobile. They want to be able to pick up their grandkids, their kids. They don't want to be the lazy dad that can't freaking participate, sitting there on the sidelines. Those are the people that would very, very highly benefit from what we do. We have a very impactful part of someone's recovery process in that, because most of healthcare is just negative, put you through the ringer, go through this vicious cycle, nothing good comes out of it, and now you're dwindling into this chronic cycle, or chronic pain cycle. So we have a huge opportunity, in my opinion, to be a positive light in that field and do a lot of good work for people.
So then you see chiropractic as like, I don't know, almost like I'm picturing someone carrying an Olympic torch, and that torch is like an active lifestyle.
Yeah.
You know what I mean? Like you're like we're the ones who are like keeping that flame going so that
Absolutely.
people can live the life that they want to live. And I think that's interesting because I think a lot of people, when they think about, if you were going to describe that to someone, they would think, oh, that should be physical therapists.
Right. Well, no. I mean, again, it should be a hybrid.
Yeah.
They should be the same freaking thing, honestly. And there's very, very bad PTs. There's very, very bad chiros. The title is irrelevant, like I said earlier. It's like if you're a clinician and you want to help people in the musculoskeletal world avoid surgery and prolong their exercise life, there's no better profession than PT and chiro hybrid, in my opinion.
The title is irrelevant. You just single-handedly pissed off half of the PT profession and over half of the chiropractic profession in one
It's
sentence.
true.
I mean,
It's all ego.
yeah.
Look at yourself in the mirror and tell yourself that the little paper is going to really provide you a huge difference from the PT and the chiro. If you're doing good work, it should look very similar.
So it's kind of like MDDO. You know,
Yeah.
they are uniquely their own professions, but as far as and they'll practice slightly different, but they're interchangeable.
Mm-hmm.
You know, you can go get there's some variability there, but their licenses are the same. So if you're hiring a physician at a hospital, it could be an MD or a DO. It doesn't really matter as long as they have the residency that you want.
Right.
So maybe a future where, you know, someone could go into a clinic and it's like chiropractor or PT. It's going to be very similar. I think that's interesting. I've heard some people talk about that before. Hey guys, unfortunately we had some type of technical difficulty and the call got dropped or the connection got severed. Anyway, I didn't get to finish the episode with Jeremy this time, so we're definitely going to have him on again. I hope you enjoyed this episode, and thanks for listening.